are back and moving into our second conversation this morning. It's all about Cancer Awareness and Cancer Awareness Month. This is October. And to join us to talk more about Cancer Awareness Month, we have in studio Dr. Ramon Yacab, who is an oncologist at the KHMH. Good morning, Doc.
Good morning.
And we have Nurse Natasha Vicente, also employed at the KHMH. Good morning.
Good morning.
And joining us via Zoom, we have Chelsea Munoz, who is a cancer patient and survivor. Good morning, Chelsea.
Good morning.
Hi, good morning.
Good morning. Well, we're here to talk about Cancer Awareness Month and, of course, to talk all about what the oncology unit at the KHMH has been doing. You all have been up and running for the better part of a year now. Talk to us about the progress, the inception and the progress, and what you think we can do more.
Yes. Now, as you mentioned, the oncology unit has been open for a year, and during its inception, it was in August actually, during COVID. And we did that in the planning because we were seeing so many cancer cases. During the COVID pandemic, we continued having the clinic go through, and we were seeing over 200-300 patients per year, even during COVID. So we said, okay, we need to continue this. We had already been doing the legwork in terms of getting the refurbishing, the restructuring of the unit, getting the equipment, training for human resources, and we said, okay, it's time to open. Now, during the past year, what are the services that we have been offering? And it's not only the unit for the hospital. It's everyone's getting involved in the hospital, from the diagnosis. If a patient has a suspicion, the surgeon sees the patient, the surgeon evaluates the biopsy, and we follow that biopsy or the patient very promptly. We establish treatment regimens based on the stage. So we do consultation for diagnosis, for staging, for treatment. We also do referral because we do not have radiation services available here in Belize. Not only that, but an integral part is also the follow-up. It is important that every patient who's diagnosed with a cancer has the adequate follow-up for a given time. And unfortunately, there is a big portion of patients diagnosed with cancer with an advanced disease in country. So we also offer palliative care, and we work in partnership with our different stakeholders, including the Belize Hospice and Palliative Care Foundation, to ensure that patients have that continuum of care from diagnosis all the way up to.
Can you break down what that means for me in terms of the disease that comes with the cancer patient? What does that mean, and what kind of diseases are you talking about in particular?
Yes. When it comes to cancer, there are different types. And in Belize, breast cancer is the leading cause of cancer. We see it on a regular day. If I'm having 10 or 20 consultations coming per day, half of them are women. And it's what worries is that it's women in their productive years. The larger portion of patients coming in and 40s, 50s, and we're having patients who are under the age for screening who are coming in with cancers, with breast cancers. And the other worrisome part on what we're seeing on a daily basis is the stage. Most patients are coming in with either a stage 3 cancer or a stage 4 breast cancer.
Wow.
We would have wanted, ideally, to have early detection, to have it successful, and get every single patient either at a stage 1 or a stage 2. However, our reality is quite different.
Can you just very quickly, I guess for some of our viewers, also break down sort of what we are talking about by the different stages of cancer? Because we hear it often, and I think a lot of people don't really fully understand what each one means.
Sure. A stage 1 breast cancer is a cancer that would generally measure less than 2 centimeters. It's the patient that they do their mammograms, we're able to detect it, and the patient goes for treatment. And mostly it will only be a surgery, depending on the context, a partial removal of the breast or breast conserving surgery, or a mastectomy, depending on preference. But the patient may only need surgery plus or minus chemo if needed or not. Now, a stage 2 cancer is a tumor that may measure over 2 centimeters. It's generally when that's the patient that's generally doing her self-exam and she's able to feel a lump. Most patients, when that happens, we already know it's generally a stage 2 cancer. It has to be between 2 to 4 centimeters in size. A stage 3 cancer already has evidence of regional spreading, meaning it's not only confined to the breast, but now it may be affecting the area on the armpit area. And that poses a higher risk. Why? The higher the stage, the more aggressive treatment the patient will require. And unfortunately, when it comes to a stage 4 cancer, it's a cancer that has already spread to the bones, to the liver, to the lungs, and it's not curable. So the prognosis changes completely. That's what we generally say when it comes to staging, and even in the treatment, there are limitations. Why? The components of cancer treatment for breast surgery that can be performed here in Belize. Chemotherapy, it can be performed here in Belize. But what happens to the patients that need radiation? And since most patients are coming with an advanced cancer, either a stage 3, automatically we do know that from the beginning or from inception that they will require radiation.
I want to get Chelsea in on the conversation, and just because she is a cancer survivor. Chelsea, thank you so much for joining us this morning, whether it be via Zoom. Can you talk to us about your journey and what it is that you would want a message to be sent out to our viewers in terms of being aware of cancer?
Hi, good morning. That's a very good question, and I get asked this all the time. So I was diagnosed with Hodgkin's lymphoma, stage 2, at the age of 19, going on to 20.
Wow.
So I was really young when I was diagnosed, and I believe one of the most important things, and like Dr. Yacab stressed, that many young people now are getting diagnosed with cancer. People that are too young to get screening. So I would say the most important thing is just pay attention to your body. And we all know our body very well. And if you see anything alarming, please get it checked up. It's super important for anyone at any age. And that's what happened to me. I noticed swollen lymph nodes on my neck area. And I lost a lot of weight, and that's how I knew that I had to go and get checked up. And I was diagnosed immediately. I got checked up at Medical Associates, and then I moved to Merida to get treatment and just get second opinions and stuff. But I strongly urge everyone to just pay close attention to your body. Also, it's important, even if you don't see anything alarming with your body, to just take that visit to the doctor, to the hospital, and just get checked up, get everything checked up. My parents recently, they visited the hospital, and they did a complete checkup just to make sure that everything is okay, because early detection is super important, like Dr. Yacab said, and it prevents later on in the future a lot of time. It can save you money and even save your life.
Nurse Natasha, I want to get your opinion on the culture that we have in Belize in terms of why is it that we don't want to go get checked out? What happens to us where you would see a patient, you said, have you been coming recently to get checked? And they said, they don't want to do that, right? So what do you think it is about us that we don't want to go and get checked?
I just think like many of us, they think that we're young. Cancer is an old person disease. And that's a lie. Like right now at the unit, we have, I'll give you a scenario. Like the other day we had a patient. He came and we had a younger female and him. He's much older, like 50s, 60s, right? So he looks at the patient and he says, well, aren't you too young to have cancer? So the patient felt away, yes, because for like myself, I'm within the age range, you know, because we're young. We say, oh well, that won't happen to me, but that's not it, and then that makes us scared to go and get checked, get tested. Or like most Belizeans, we don't want to know. If we don't know, it doesn't hurt.
Right.
So then majority of us, well, I'd say more my age, because we're the age that's partying and being out and don't want to get tested or get checked. And so like that, I would say that's a gap between. But the self-exam, it's not something that you should be ashamed of. Having cancer, you should not be ashamed or be afraid to go and find out. The earlier you know, the better.
Right.
There's more option for treatment and a curative intent, rather than finding out that way late that you're at stage 4, and then it's harder and more emotional for the patient.
And you know, working within the unit, what are the sort of daily, let's say, you know, the things that both of you see daily, as both as a doctor and a nurse, and people who are undergoing this form of treatment for cancer, the different types. So you spoke a little bit about chemotherapy and things earlier. So what are some typical things that occur in a day in a hospital? So I'll go to the doctor first, and then you can start.
Well, it starts with generally it's a full day always.
Yeah.
We're always having a full day, and we're having the group of patients. We're coming in with the suspicion. We're actually having patients coming in, Doc, I felt this. I don't have a diagnosis. Do you have any recommendations? And the alarming part is that when they're coming in, we're seeing clinically that it is a cancer. So it means that, and when we're having that conversation with the patient, how long did this start? They tell me 6 months ago, 1 year ago, and that's mostly talking about breast cancer. The other part is the emotional part, the social aspect. Yes, we're talking about cancers one-on-one with the patient. I may be recommending treatment, but when we dive into their life, we have mothers, we have fathers, that tell me, Doc, I didn't come in because it was either I work to eat or either get my test because it wasn't improving and I just thought worsening. I'm coming in now. Family support is also a big, I've been seeing that growing, that there's that big stigma when it comes to the word cancer. So it's us doing the clinical part, trying to offer a portion of emotional support for patients and just trying to be with them during the whole journey. We need to guide them.
And nurse, for you?
Well, for us, mainly we're in the infusion room. So for patients who are doing the chemotherapy for the first time, there's a lot of coaching. Sometimes there's language barrier, but we get Dr. Yacab or Dr. Habet to translate. But it's mostly emotional. And then coaching them through the chemotherapy and each cycle. By the time they're finished, you're like, okay, that was fast. But most the majority of the time it's emotional. We administer the chemotherapy, coach them through.
So in terms of, since we're talking about support and emotional value when it comes to cancer, Chelsea, walk us through your support system. And you know, I can't even imagine the amount of roller coaster of emotions that you had experienced throughout your journey. But you are officially cancer-free, yes, and you are now an advocate for cancer awareness. So let's talk to us about your support and how you have been campaigning.
So yes, I've been in remission. I'm going for about 3 years now.
Congratulations.
Thank you. It's, you know, from the very beginning when I was diagnosed, it was a roller coaster with emotions. Like many cancer patients or cancer survivors would say. The biggest thing for me and the biggest support that I had, it was my parents and my family, my immediate family. I think it's super important to lean on them because at the end of the day, your family will have your best interests at heart. And there's nobody else like family, right? So they were a huge support for me. But at the time when I was diagnosed, I had also I won a pageant I'm from San Pedro, so I won Miss San Pedro at the time. And I had to deal with being a beauty ambassador and also going through chemo and being diagnosed with cancer.
Wow.
It was a tough challenge for me, but I also had the support from my San Pedranos, my community. They were a huge help. They did fundraisers. They sent me messages with like encouraging letters, encouraging words. And I know that many people here in Belize, some do have the support from their family members, from friends. But for those that that don't have the support, I urge you to just try your very best to stay positive. It is a tough road to be on, but and it is a scary one too. But I believe that although this illness seems kind of like a prison sentence, you will look back on it and learn so much about yourself and so much about your own strength. I believe that God only gives his hardest battles to his strongest and strongest fighters. So you can definitely do it. That's pretty much like how I would encourage people that don't really have that support from their family members and stuff. Because there's some people that have to fight this all alone, and I can only imagine how hard that must be for them.
Thank you for sharing your story with us, Chelsea. I said to Gavin, she looks so familiar, and then when the beauty pictures came up, I said that's how I remember her. But coming back to you, Dr. Yacab, in terms of prevention, right? And this is something that we kind of know in terms of what radiation can do. It can also jumpstart other heart diseases and so forth. So what measures do you have to take in the oncology unit to make sure that maybe it doesn't get to that stage?
Okay. In terms of us as health personnel, well, what we're doing is we have within the unit different areas. One, where the chemotherapy is generally mixed or prepared in a sterile fashion. We have a hood over available at the hospital that decreases the exposure to the drug. Not only that, but during the chemo administration, well, Nurse Vicente, they generally use their protective equipment too, their PPEs, to administer both the chemotherapy safely with a minimal risk or exposure towards health professionals, and at the same time administering it safely to the patient.
Right. And Nurse Vicente?
Well, for us, we have, even though like there are multiple patients within the room that are receiving chemotherapy, each one, sometimes they are receiving the same regimen, or sometimes it's different. So we have to ensure that we don't make contact from one medication to the patient. So then like that, we take our risk, we sanitize and, precautions for each patient.
So,
And Doctor, you had said earlier that most or a large part of the diagnoses are for breast cancer. But can you talk a little bit about, sort of other things that you've also been seeing, and sort of where, I guess a lot of people may associate cancers with, let's say, genetic history or whatever, but are there other factors which lead to different types of cancers, and what are we seeing that's reflected in the general population that you see?
Yeah. Now, as well, we do know that breast cancer is it's the largest group. However, the second most common cancer that we see on a daily day is cervical cancer, and that hits very hard. Why? Cervical cancer is preventable, and that's what hurts, seeing patients coming in with an advanced cancer. Next type of cancer, colon cancer, prostate cancer, lung cancers. Those are the most common ones that we're seeing. In terms of what's of its relation with hereditary factors, we do know that family history is important, but will only be responsible in 10 to 20% of cases. So that means that there has to be environmental factors and other factors that may lead to a cancer. And that's important to know, because some of the remarks that I generally get from relatives or patients, I don't have a history of breast cancer, I don't have a history of cancer. There's that big notion outside that if we don't have it, it doesn't mean we're at risk, when it's not. So now, about cervical cancer, it is preventable, it is caused by HPV, and the biggest recommendation right now is get your vaccines. Have all the girls 9 to 13 years get their HPV vaccine shots. The boys too, we can prevent it. Unlike the other types of cancer, yes, daily having a physical activity, doing exercise, having a well-balanced diet, it can reduce the risk up to 1/3, but we still have the other 2/3 that we are going to diagnose. So we may not be able to prevent all of them, but we can certainly detect early the most common types.
Now, what is the oncology unit doing this year to raise awareness for Cancer Awareness Month, besides coming on Open Your Eyes?
Well, that's important to mention. Through the hospital, we're doing raising awareness through social media. We've also been engaging with different stakeholders. We've been partnering with the Cancer Society over at the San Ignacio branch, raising awareness within the community. We've been partnering with the Orange Walk Cancer Support Group, raising awareness over there, doing chats, and also the Rotaract groups going from places to places, trying to raise awareness within the school, within the communities. That's from our part in the oncology unit. Not only that, but also being an advocate within the community and with the rest of the health allied professionals, because we do know that it is important for a country and a community to know about cancer, but also for us who are directly in contact with the patient, know when to refer the patient, know when it's time, so that we can optimize, diagnose adequately.
Is there anything that you would like our viewers to take ownership with when it comes to cancer awareness? You know, like you rightfully mentioned, we feel like we're young, so it's not going to happen to us, or we don't have a genetic history, so it's not going to happen to us. So what is it that you would like our viewers to take away from this conversation?
Remember, cancer is, from my part, it's as Chelsea mentioned, and as we all know, early detection saves lives. You know your body. If you're noticing that something is abnormal, if something is wrong, please get checked. And we have to emphasize on having your screening. Do your screening mammogram, do your pap smears, do your colonoscopies, do your screening, because we need to have that embedded in our culture. Early detection saves lives.
All right. A nurse?
I'm with Dr. Yacab. It's just, you know, we have the resources. Pap smears, they're available at the clinics, private, public. Colonoscopies, well, the mammograms, we have them available. It's not like we're limited. Yes, we have our limitations to treatment, radiation, and so forth. But detection and prevention, it's open. So don't be afraid. Just go and get checked.
Just go and get checked.
It doesn't hurt. Well, some are uncomfortable, but it's good to know.
And Chelsea, final words for our viewers.
Hi. Well, pretty much everything that Nurse and Dr. Yacab said. I would also like to mention that it's amazing that Belize is now offering many services for cancer patients to make sure that every person that is diagnosed with cancer gets adequate care. I think that we've come a long way, and I have to applaud the team, Dr. Yacab and his team, for a job well done and taking care of our Belizean people. I think that's super important to just notice all the hard work that they're doing. Also, another thing I would like to stress, and I know many people don't like to hear this, but it's crucial for all of us to maintain a healthy diet. Make sure you include all your food groups, get enough vitamins, and do your daily exercise, even if it's just a walk. Some days when I don't feel like exercising, like doing hard workout, just go for a walk. It's just a matter of getting your body moving, your blood pumping, and it's just important to practice those healthy routines.
Perfect.
But that's pretty much it. Thank you so much for having me on the show.
Thank you, Chelsea. Thank you so much, Dr.
Thank
Yacab.
you.
Thank you so much, Nurse Vicente, for coming in. It is Cancer Awareness Month, and we will continuously be talking about that for the rest of October. But before we get into our final conversation, we're going to take that short break, so don't go anywhere. Be right